One of the most eagerly awaited sessions at this year's EASD Congress is the session on the emerging consensus on screening for type 1 diabetes. Now, that's something that probably 5 years ago, people wouldn't have even thought possible. But yet, here we are. And I'd like to introduce you to 3 people who've been very involved in this right from the start. So Anette Ziegler from the Helmholtz in Munich, Chantal Mathieu, who you will also, of course, know as your president, and Anastasia Albanese O'Neill from
Breakthrough T1D.
Breakthrough T1D. So there you have the top team. So first of all, why screen for type 1 diabetes? Annette.
Early detection of type 1 diabetes can really help decreasing complications at onset, and also is the prerequisite for what we really aim to, namely preventing and delaying the disease, because this is only possible if we identify people early so that they can have access to disease-modifying treatments.
Now, Breakthrough have been hugely involved in all of this. When did this kind of start to bubble up? Because as I've said, this is really, hot news. It's very, very recent.
Well, this is a 1-hour session at EASD, but it represents decades of research and work behind the scenes by the people I'm sitting here with right now. And we need to answer an essential question for people in clinical practice. Last year, we brought forward the monitoring guidance to answer the question, if I screen for someone to detect early stage type 1 diabetes, what is my follow-up plan of care? Now, clinicians are asking, who do I screen? How often? In what setting? And how do I communicate with them? This document answers that second set of questions.
Okay, so Chantal, who do we screen?
Well, that's really already one of the big discussion points. So what we agreed as consensus was, we say now is the time to screen the general population for early stage type 1 diabetes. But if you've never screened before in your region, in your country, a good place to start is to set up screening for family members, genetically at-risk individuals, where then you can roll out progressively to the general population. But the aim should be, with everything we know now, to bring screening as soon as possible to the general population.
And the next question, Annette, is when do you screen? Because you've been very involved in screening in childhood.
So what we are recommending is to do actually screening 3 times at 3 ages, 2 to 4, 6 to 8, and 10 to 15 years of age. But of course, we acknowledge that that may also not be possible if you start to screen for the first time. So you can also have already some good sensitivity if you start screening only once at age 3 to 4 years. What is very special about these antibodies, they don't appear at the same rate throughout lifetime. There is a big peak early in childhood, and this is why it is so sensitive to screen early. And for a once screening, the biggest sensitivity is between 3 and 4, but you can increase to up to 80% if you screen 3 times, and that's the recommendation.
And presumably what you're doing is you are screening, picking out the 10% of people with the highest level of antibodies? Is that how it works?
It's actually less. So we have 2 steps in the process. The one is a screening test, and this one we set to mostly something like the 98th centile, that we are picking up 2% of the population, but we expect only around 0.3, 4, 5%, depending on the country prevalence, to be truly positive. So the screening test.
So by truly positive, you mean to have
early stage type 1 diabetes. So the screening test is set so that you are very sensitive, and then you have to do a confirmation test as a second step. And this test is set to be extremely specific. And then there will be some that do not confirm. That's normal, because our first test has a lower threshold. And with the 2 steps, we think that we have a specificity that is actually over 99.8%.
Wow. That's really very impressive. And what would you see this achieving, Anastasia? I mean, I know we're thinking about, delaying treatments and all those other things, but, in the short term, what might this achieve?
Yeah. So if we only screen family members, we will miss 85 to 90% of people who will progress, who will go on to have a diagnosis of stage 3 or clinical type 1 diabetes. So it's essential so that everyone, family members and people in the general population, can realize what we see as the benefits of screening. The first is we have strong evidence, again, thanks to the work of the people I'm sitting with here today, that we can prevent diabetic ketoacidosis at diagnosis, getting those rates all the way down to the single digits, 3% in the FRIDA
and that
study.
in itself is worth doing.
That in itself is a clinical imperative, but also it gives people time to plan and prepare. It gives them a sort of a smoother landing with that stage 3 diagnosis. We have an approved therapy to delay the progression of type 1 diabetes and protect those beta cells, approved in 4 countries, maybe more eventually. And then finally, we have essential clinical trials where we need to engage people who are in early stages of type 1 diabetes so we can eventually realize our ultimate goal of preventing type 1 diabetes altogether.
Now, Chantal, I'm looking at the policy queen here.
Yeah.
Because, the European Diabetes Forum is very much on the front foot in terms of its interactions with policymakers. And this would have important implications for policymakers.
Absolutely. And again, with the European Diabetes Forum, we put early detection and prevention of diabetes as a whole, highlighting not only type 2 diabetes, but also type 1 diabetes on the forefront and on the agenda of European politics. This being said, what needs to happen is in each and every country. And in some countries, it's even in different regions that the policy needs to be made to make screening for early stage type 1 diabetes the law. And it is now interesting. You started by saying 5 years ago we wouldn't be sitting here. I can tell you the example of Italy, for instance, where they have
screening, yes.
Where they have put screening of the general population for early stage type 1 diabetes in the law. This has created a bit of a shock because, of course, France looks and Belgium looks and other countries look and say, if the Italians do it, why don't we do it? And so the doors have started opening in our different regions and countries to at least start discussing how will we do this in our country, what will be the cost effectiveness of doing this. And also people are now reflecting on how should we adapt our healthcare systems, our clinics, into this screening for early stage type 1 diabetes.
And Anastasia, do you see also this moving in the future towards, say, polygenic risk scoring in newborns, having whole genome sequencing?
Yes. So genetic screening is another approach to detecting risk and ultimately progression to type 1 diabetes. What we know about genetic screening, and I may defer to the experts here, but we know about genetic screening, meaning HLA, high resolution HLA, is that most people in the highest risk category do not progress to a diagnosis of type 1 diabetes. So ultimately what we need is a combination of genetic screening, this is in the future, and autoantibody screening. And this will also help us in terms of individualized or personalized medicine, or precision medicine, when we think about what person will respond best to which therapy. And I think the real promise is there in the future, is helping understand who will progress at what rate and who will respond best to which therapy.
And Chantal, this has been given added salience by the fact that here, kind of right now, are the things that we never thought that we would have, is potential therapies to delay or perhaps even in the future prevent type 1 diabetes from developing.
Absolutely, and it will happen. I'm absolutely convinced of that. When now we look at our knowledge of type 1 diabetes, our possibility to detect people and really say, you have an early stage. Genetic screening is screening for risk. What we're doing with the antibody screening is detecting the disease, albeit in a preclinical stage. But this, together with the emerging therapies, will eventually lead to prevention. And Anastasia flagged it. Yes, we have an approved agent, teplizumab, in many countries, hopefully very soon also in mainland Europe, in the EU. But the amount of new therapies coming out and being tested in these individuals is staggering. And I am convinced we will see a prevention of type 1 diabetes.
Finally, all three of you have been involved in this for almost all of your careers. How does it make you feel to be involved in that session on Friday morning after the years that you've spent? Anette?
In the therapy. I think that is what we dreamt. We still are not at our final goal of really having a world without type 1 diabetes, preventing diabetes. But I think, as Chantal said, we are on the best way and have first agents that can really do this. And there will be more and more to come. And it's not only T-sealed.
I've treated mice all my life, preventing type 1 diabetes in mice and curing mice. And to me, it's, being also a clinician, this is now the dream that indeed we see, first of all, our ability to detect people in an early stage, and then also see therapies now that are able to really interfere with the destruction of the beta cell. But I think, Anastasia, coming from Breakthrough T1D, that was really the dream of the women who started JDRF,
Yes.
JDF.
I was going to come
days.
to you last of all because I wanted actually to pay tribute to, the determination and actually the consistency with which JDRF and now Breakthrough have pursued this goal. You've been relentless about it. And also not only you have been relentless, but your supporters and their huge generosity have really made this possible. So final word to you.
Yeah, I want to thank you for that acknowledgement. It's really an honor to be with these giants in the field. But I'm going to take off my Breakthrough T1D hat and my clinical hat, and I'm going to speak as a mother of a child diagnosed with type 1 diabetes 23 years ago in severe DKA at diagnosis. The benefits from screening for early detection, to me personally, are profound, and the fact that we have so many therapies in clinical trials is indeed a realization of the promise of the hope that our founding mothers had back in 1971. And I'm honored to be a part of that legacy. It's going to take a global community to get it done. But as Chantal has said, we will get there. We need to keep the forward momentum.
Ask a busy woman and it will be done. Well, thank you all very much indeed. So this is a tremendous session. It's happening today. That's Tuesday at 5 p.m. If you're not able to look at the session, you can, of course, look at it later online through the EASD site. And it's one that's going to be a very memorable one, which I think is going to stay with you for a very long time.